My name is Fav Ola. I'm currently a master's student in the neuroscience department at Carleton University, working under the supervision of Dr. Jennifer Phillips. Today, I will be presenting preliminary evidence of efficacy of esketamine for depression in a naturalistic setting. In 2019, Dr. Raj Batla and Katarina Nikolic received an innovation grant to establish a clinic at the Royal to administer esketamine. Esketamine is a novel rapid-acting medication for resistant depression. In this presentation, I will talk about some preliminary data we have for the first patients who have received the treatment at the Royal's Esketamine service since 2021. Worldwide, major depressive disorder has the largest burden of diseases among mental, neurological, and substance use disorders. This is according to the World Health Organization. Today, about 280 million people have been diagnosed with depression. Bipolar disorder adds a burden to this, as patients spend most of their symptomatic time in a major depressive episode rather than in a hypomanic or manic episode. Although there are effective treatments for depression, 1/3 of patients do not respond to various trials of conventional antidepressants that we have today. Esketamine is an intranasal formulation of ketamine that has recently emerged as a novel treatment for depression. Esketamine has demonstrated rapid antidepressant effects with higher response rates when compared to conventional medications. At the Royal's Esketamine service, we are systematically collecting patients' data during the course of their treatment. Our goal for this preliminary analysis was to examine the presenting clinical characteristics of patients with mood disorders who are currently receiving treatment in the Royal's Esketamine service and to provide preliminary data on treatment efficacy. Treatment in the Esketamine service is not being administered in a clinical trial setting, rather in a real-world observation of psychiatric treatment response in tertiary care. This far, we have 10 patients. We have 4 females and 6 males. In terms of primary psychiatric diagnosis, 9 people have major depressive disorder, 1 person has bipolar disorder. All of these patients also had co-occurring psychiatric diagnosis. Patients had generalized anxiety disorder, 3 patients have attention deficit hyperactive disorder, 1 patient has post-traumatic stress disorder. Esketamine is administered twice a week for the first 4 weeks. This is called the induction phase. During this time, we administer clinical ratings to evaluate the severity of depression symptoms using the Montgomery-Åsberg Depression Rating Scale, suicidal ideation using the Columbia Suicide Severity Rating Scale. We collect these measures at 3 time points: before they start treatment, at mid-treatment, which is after 2 weeks, and at post-treatment, after 4 weeks. We also use the Beck Hopelessness Scale to collect information on hopelessness. This scale is a self-report measure that patients complete at 2 time points. So that's pre-treatment and post-treatment. Patients who show a positive response to induction phase treatment continue to receive maintenance esketamine, which involves administering the medication at reduced frequencies. In terms of preliminary efficacy analysis, using a repeated measures ANOVA to compare MADRS scores over the 3 time points, we see that there was an overall significant effect of time. As patients undergo treatment, there was a significant effect of time for depressive symptoms. This means that decreasing MADRS scores over time was significant. For suicidal ideation severity measured using the Columbia, there was a significant effect of time with a clear cumulative decrease in suicidal ideation severity through the induction phase. You can see here. There was also a meaningful reduction in hopelessness, which is measured through the self-report questionnaire. For the CGI, this is the Clinical Global Improvement Scale, which is the rater's overall impression of patients' illness severity. We use this to measure improvement or deterioration of patients' condition as they're being treated. Overall, we observed that 40% of patients had a clinically meaningful improvement, while 1 patient had a substantial improvement after 4 weeks. This means that there was a 1 point or a 2-point increase in patient symptom improvement. This preliminary analysis supports the rapid-acting antidepressant and anti-suicidal effect of esketamine in patients with depression. As this treatment moves from clinical trial setting to a clinical practice setting, there's an urgent need to better understand how it works in a naturalistic setting. Thank you.